Rajiv Menon, the chief guest of today's function, my good friend, and sometimes we walk together. He has a wide knowledge, and I'm sure he will have something to say on health and environment, or environment and health. Dr. Somasundaram, who is still to come, he's in government service and he has some urgent work. And I know him since 2017, when we first conducted the International Salt Conference in IIT with IIT jointly. So that's the time I met him, and that is in 2017. And Dr. Balasubramaniam, the dynamic nephrologist from the Government General Hospital and Madras Medical College, who will talk to us today on the World Kidney Day themed for this year. Madhu Balaji, who is a part of our foundation, dignitaries and friends, and my friend from Nasik, C. Venkata Subramaniam, Lakshman, who has come from Bangalore. This time Mohammed has expressed his inability to come from Hyderabad. Every time he calls himself the hero of 1989, and he has sent a check for 3 lakhs, but he hasn't done it because of Ramzan. So he said that he would not be able to come. I am sure many of you who have heard him would miss him. Yeah, World Kidney Day, let's go back. Yeah, World Kidney Day celebration started in 2005. The purpose was to create awareness about kidney disease and to prevent. See, I have been talking every year, I'm sure many of you have heard it before. The need for handling kidney disease is very important because almost 10% of the adult population have an impaired kidney function. And even if a small minuscule of that lands up on dialysis, it's going to be an enormous burden to both the finance as well as to the healthcare system. So prevention, any prevention in this, and it's possible to prevent kidney disease. So prevention of kidney disease is very important. All over the world, the prevention started from 2005 in the sense the World Kidney Day started celebrations every year on the second Thursday of March. So we have been celebrating since 2005, the same year. And the basic thesis theme, as I said, the very first one was know your kidneys. So you should know the functions of the kidney and the structure of the kidney to understand why the kidneys are affected, why such a large population is affected by kidney disease, why kidney diseases are without symptoms, why they get detected very late, and can you detect it early. So these are all reasons every year. I am sure it's a repetition for many of you. Almost 180 liters of blood is received in the kidney per day, is filtered, so only 1.5 comes as a urine. So even if 10% of the kidney function is left, somebody can pass a normal quantity of urine. So urinary tract symptoms may not happen in kidney disease. That's why it gets missed. And if you know the function of the kidney, you will understand why the symptoms are referred elsewhere. The basic function of the kidney is to maintain the internal environment of the body. So when kidneys get disturbed, the internal environment gets disturbed. That means every organ can get disturbed. So that's why the symptoms are often not in the urinary tract. They are referred elsewhere. Somebody comes with weakness. Somebody comes with vomiting sensation. Somebody comes even with drowsiness, fits. And then you tell them you have got a kidney failure and that's the cause. They cannot understand it. They wonder why is it so? Because the body's internal environment is maintained by the kidneys. These are old slides. Actually, I made it in 2005, but still they are applicable. The same thing, how do we detect it early? Again, early detection of kidney disease, is it possible? By detecting protein leak in the urine, many of the 85% of the kidney disease can be detected early before the function is affected. So good control of diabetes, control of hypertension, avoidance of substances which would damage the kidney, avoidance of drugs is very important. It's not just modern medicine drugs. You have so many other systems, Ayurvedic, Unani, Siddha, so many medications. Many of them have not been studied on the effect on the kidney. I'll go a bit fast because I'll leave the prevention more to Dr. Balasubramaniam, who is going to expand on the theme for this year. So our advice, which still stands, reduce the salt intake, have a balanced diet, exercise every day, stop smoking, avoid over-the-counter medicines, check for urine or albumin in the urine once a year, etc. still stands good. So we started our program in 2002 actually, when Professor Tanabe and Toma visited us. Japanese people are the world leaders in prevention of kidney disease. What they do is they check the urine of every school child every year for protein leak and blood leak. That's how they detect kidney disease early and then take the necessary action. So we have been associated with them fortunately from 2002, and we do conduct in several schools and colleges in and around Chennai camps for detecting kidney disease early. Of course, some of you would have heard last year or the year before in anniversary, I spoke about the research Tanabe is doing on the apoptosis inhibitor of macrophage, or the A molecule. This AIM molecule is what he calls it is an internal dialysis, that it is going to replace avoid patients going on dialysis. Right now the experiments are being done in cats, and where the dialysis has got postponed by 5 to 6 years, which is a good duration. If you consider the cat's age itself is about 12 years. So you have about 5 years of postponement in dialysis. And I was told just before the meeting, I spoke to him, and he said that they are right now trying it in acute kidney injury in human beings also, where the recovery has been faster by giving this apoptosis inhibitor molecule. Of course, these are the various themes for the World Kidney Day, and protect your kidney, save your heart. It implied that patients with kidney disease, the heart is often affected. Basically, you should know that kidney disease is a disease of the blood vessels. So when you get that affected, the heart is also affected in many of them. You take care of your kidneys, you are likely to take care of your heart. Kidneys for life. Stop acute kidney injury. Avoid toxins. Avoid something that will produce an acute temporary cessation of the kidney function. Kidneys age, just while alive. So these are tips to how to protect your kidney once you age. As you age, the kidney function goes down, your ability to excrete salt comes down, you require more potassium. You require to modify the dose of various drugs that you take with age. This is very important. So you have to take care of all these things as you age. In children have specific situations which can damage the kidney. You have a congenital condition called reflux, where the urine instead of going out goes back to the kidney and then it damages the kidney. So children have this reflux nephropathy. And if you detect early, say the first year of life, if you detect the urine infection, you can prevent the kidney from getting scarred or damaged. These people present with kidney failure later in life, but the prevention has to be taken in the first year of life. See, in children, it's often they don't have symptoms in the urine. The general practitioner just gives the course of antibiotic. They don't investigate further for any problem, abnormalities in the urinary tract. Yeah, this is children, yes. Obesity. Obesity affects the kidney function. Obesity is a load on the kidney function. The filtration increases, the protein leak increases, so it's very important. Now you know the blockbuster drugs, these GLP-1 inhibitors, what are called? You would know it as Monjaro or Ozempic and such drugs. They're all being used widely all over the world. They are blockbusters now. They are making a killing. People want to lose weight. It's being abused also, not just used. So obesity is very important, that you lose your weight so that the kidney function is better. And women are specifically more prone for kidney disease. Right from childhood, because of the urinary tract infections that can happen due to the short urinary passage. Pregnancy again is a load on the kidney. Many of the kidney diseases worsen during pregnancy. So you have to be careful having pregnancy with kidney disease. And of course lupus. SLE is a disease which can affect women more than men. And lastly, the unfortunate thing is that women are often at the back, the man is given the priority. So very often the man gets the treatment and not the women in the house. Because of that, kidney disease worsens in women more often. For everyone, everywhere, these are all just every year we have been living well with kidney disease. We have several patients who are doing well after kidney transplant or dialysis. We have a person who after transplant plays tennis. That one of the picture you saw in the World Games, Olympic Games, Para-Olympic, he got the gold medal. He was a patient, Hari Kumar. He had a kidney transplant. His wife gave the kidney, and 2 years later he got the gold medal in the World Paralympics. But unfortunately, the government did not recognize it. We, of course, recognized him and had a function held in the same place. And Shrikant Krishnamachari was the chief guest for that. Of course, you have to improve the knowledge. You have to educate people to detect. It's very important. Not just the... One of the simplest thing is hypertension. People should realize that if you have high blood pressure, it could be a marker of kidney disease. Remember this. So many times, unfortunately, people with high blood pressure go to the cardiologist and they don't line up with the nephrologist. They don't look at the kidneys. So kidney blood pressure, high blood pressure could be a marker of kidney disease. All these are themes last year's thing, detect early again. And the Cystinosis Foundation, some update on what the activities we are doing in the foundation. In 2012, we started the Cystinosis Foundation of India. Cystinosis is a rare disease. It's called an orphan disease because there are less than 2,000 patients in the world, children. And the cystine is a molecule which accumulates in the cell. It is not removed. So it destroys the tissue. So it destroys the kidneys, it destroys other organs, thyroid, it destroys bones, so many other organs. So it's a systemic disease. The cystine is not removed from the body. It's called cystinosis. So when we started, there were only 4 children we registered for cystinosis. You will see them, it affects the growth mainly. These children they don't grow at all. This boy who is with the mother is 10-year-old. You won't believe. The other children are also much smaller. They are only 7 or 6, but they don't grow. See, this is advanced stage. If you look at the UK, I'll show you the next slide. Next, this one. See, these 2 Sardar boys had cystinosis, but they detected it in the first year of life, even before any manifestation. So they do a routine metabolic work for every child. And it's a genetically transmitted disease, so they detected it early. Get treatment. Treatment is available. And these 2 boys have grown so much. This I saw in 2014. That's how I started the foundation here. I said our children should also receive the treatment. We started with 4 children. We have been sponsoring the treatment and running the foundation. Right now we have 58 children registered. I think it's going to be 60. 2 more are, the picture is not put on this thing, isn't it? Yeah. 2 more. So it's going to be 60 children. And we are sponsoring for quite a few of them the treatment. The treatment cost is about 3 lakhs a year. We get the drug from Europe. And many of you, thanks to many of your, the donors who have been generous to us, the foundation, and we have been able to help these children. See this boy in 2012 and now in 2026. This boy is now 20 years of age. When he came to me, he was 7 years. He was responsible for me to start the foundation. I did his kidney transplant. And then he went to the school on the 3rd month and he said, I can't see the board. So then we identified, got the eye doctor to see it. His full eye was full of crystals. That is called cystine crystals. He was not able to see, he was getting blind. So then we picked up so late. He had met several nephrologists, not me. He had met quite a few of the top nephrologists in the country and everybody had missed it at that time. So then this boy, we started him on treatment. You can see him now. He wants to do, he's 20 years. He wants to study for IAS. This boy, Hariharan, he is also running a Xerox shop. When he came to us, he was like this. Now in 26, he is running a Xerox shop near Trichy. And this boy, Sri Krishna, he is doing occupational therapy. He wanted to do allied healthcare. He is now doing occupational therapy. We are sponsoring the treatment for these children, unfortunate children. Yes, our flagship program is SALT control. We started in 2010. And this is the SALT walkathon we conducted in 2010 with Crazy Mohan and Andrew Simpkins of the US Consulate. He was the consular. So we started the march. See, our mentor was Professor McGregor. Unfortunately, it is sad that we lost him last year in September 2025. And Professor McGregor was a mentor for us. He started the World Action on Salt and Health, WASH, in 2005. So his work, I'm not able to read from here, was responsible for saving millions of lives over the world. and his work was reducing salt intake in the population. In UK, if you go now, he has been relentlessly fighting for it. If you go there, the salt content of all the foodstuff has been reduced by 40% and people are not even aware. Every year, slowly, he has been reducing it. The government has been cooperating on that. The bread, which was tasting, has reduced salt by 40%, but nobody can make it out. So he has been responsible for saving billions of dollars and billions of life. Professor McGregor. Unfortunately, we lost him, and he was responsible for us to start the salt fight in India. That was in Lancet, the article. This is in Guardian. So this is very, very interesting man, very humorous man, McGregor. He told the food manufacturers, put less salt. They said, how can we put less salt? If we put less salt, they won't buy. He said, if you put less salt, they will live longer, they'll buy your products. So put more salt. Same way, he used to taste his skin and say, this is tasting salty, you are taking more salt. Normally, if your salt intake is under control, the sweat does not taste salt. It has only 5 milliequivalents of sodium, very low per liter. So if your skin is tasting salt, you are taking more salt. He said, you don't require great tests, just taste your skin. And of course, he was a man who pointed out that salt, even without raising the blood pressure, can damage the lining of the blood vessel, what is called the endothelium. So you can get strokes, heart attacks and kidney failure in the absence of hypertension, high blood pressure. So we had him in the salt conference at IIT, in the international conference. He was the main chairperson. So after his talk, one of the doctors got up and he said, not doctors, a person got up and he said, my blood pressure is very low. It is 100/70. My doctor tells me to take more salt. So Graham McGregor got down from the podium, went and said, congratulations, your blood pressure is very low. Please change your doctor. So salt can affect you even without raising the blood pressure. This is a very important point which even many doctors do not give importance. Yeah, we had the first international, you can see Professor McGregor, and that is Soumya Swaminathan, and we had Somasundram, who was supposed to come today from the Public Health, Dr. Murali and Anita from the Food Safety Standard Association. All of them took part. We had a good participation in 2017. We also had the conference in Mumbai at the same time. And of course, this was the anniversary where the posters were released. And you heard Rajnikant's talk on salt. He is very committed. You go to his house now, the food is with very low salt. he's not pulling a fast one, it's true. Yeah, we launched the Low Salter website. You can also become a member of the Low Salter so that you can get information on salt. This is on the director of public health, the previous one, Selva Vinayakam. We had a lecture in the public health department. And of course, the physicians. We were educating people. But then we thought that we should educate doctors. They are key people. They are going to spread to more population. No point in educating individuals. Now, if you educate the doctor, if you have an interaction. So we have been conducting workshops with the Resolve to Save Lives, or the RTSL from the USA. And what we found was, it was very important because many of the doctors are not aware of quite a few things about salt and health. For example, they were not aware what is the conversion between sodium and salt. How much sodium is how much common salt. This was almost half the people. And half the people did not know which are the low sodium salt substitutes, where potassium is used to substitute for sodium. So other things, many people are aware clearly, even lay people know salt and blood pressure. That association is very well established. I don't know how, but it is very well established in the population. So these meetings we have been conducting in various cities with the medical associations. We had one in Chennai, we had one in Mumbai, one in Delhi, and of course in Vijayawada also. A week back I travelled in the Vande Bharat. I found one, we just had the snack, and I was looking through. I was both happy and disappointed. I was very happy because everything had the sodium labeling. You go through it, But why I was disappointed also, I tell you. This is a salt packet that was given in addition to whatever snacks they were given. That's one. Then this is the mixed pickle. As expected, the pickle at the highest. This is 6 grams of pickle. I can't read. It has about, if you take in 100 grams, it's very high. It's about 15 grams. And 6 grams would contain almost 1.5 grams. So your daily quota is supposed to be only 5 grams. Such a small pickle, I have blown it up. It's only a 6 gram packet. It's a small packet. That small packet almost has 1.5 grams of salt. So you're going to eat this. Next, you go to the soup. Soup is the next one, culprit. And very unfortunate that in restaurants they always keep a salt shaker with you. So you add more salt to it. But these are ready-made soups, which is absolutely right. Soup again, if you consume this, another 1.5 grams is gone. Soup has so much of salt. Then this is the snack that they give, the papdi, that contains a bit of salt again. That is expected. My disappointment is this. I don't know whether you have noticed. The label says sodium. What will a layman understand sodium? See, why do you presume that people know sodium and blood pressure are related? But if I ask my most ignorant patient, he knows uppu and blood pressure. He knows salt and blood pressure. Namak and blood pressure. So why not follow the UK? UK it is always labeled salt, not sodium. This confusion is a big problem. So sodium and salt. See, salt is, because why they label it as sodium is, very often it contains not just sodium chloride. It contains sodium glutamate, it may contain sulfate, sulfide, nitrate, nitrite. So many food preservatives are all sodium. And for taste enhancers, they're all, monosodium glutamate is used as a taste enhancer. In the Chinese food, you know that. So, if you add the word salt, it covers any sodium salt, not just sodium chloride. So you don't have to, people should understand. And second thing is these labels are very small. You have to take a picture in your mobile and then blow it up to read. Reading from the packet directly is impossible. So you have to then, so conversion is also, this conversion of 1 gram of sodium is equal to 2.5 grams of salt is little difficult. I don't know how many people will remember. So that is again, human memory is not good. Unless you go on reinforcing, they will not remember. So that's the disappointment. Apart from, of course, the meal contains your whole day's quota. And then this is the ketchup. Ketchup, see, people think it's sweet, but that's again good amount of salt. Almost half a gram of salt if you have a small packet of 8 grams of ketchup. And people use so many ketchup packets, children. They add on it. This is a juice. Juice contains sodium. I just wanted to put that. Don't think just because it's sweet, it doesn't contain sodium. It has some other sodium preservative, not sodium chloride. It need not taste like salt. Again, tea. Tea also contains. So almost they are mentioned everywhere. So that's a very good point. But we are representing from the foundation to the government that they should put it as uppu, salt or namak, rather than see how are they going to put it in Hindi or Tamil. Sodium, it's going to be very difficult. So it should change like the UK and have this thing. This, another issue, big issue you are going to face. Now this is a pista, salted pista available in Velachery. Okay. And in the composition he says sodium is 0. So, gross cheating. So who is going to read this label? I don't know who is going to ever see this label or but he is just written 0 and writes adding salted pista. I thank all our donors and all of you for coming today and making a Thank you.